Have you ever suffered from burning, irritated, dry eyes? Well, if you have, it is not unusual because most of us at some point in our lives have had dry eye. It can cause blurry vision, it can cause redness, it can cause discomfort. Luckily, there are many treatment options for dry eye. But before you go to a treatment, you really should understand what the root cause of your dry eye is. And that's what we're going to be talking about in this week's episode of the IQ podcast. So stay tuned. Welcome, everyone, to another episode of the IQ podcast, where you can gain insights into your vision health and brain health and raise your IQ. I'm Dr. Rani Banik, your host, and today I have been looking forward to today's special guest interview for a very long time because we are going to be talking about a common condition that affects almost all of us at some point in our lives, which is dry eye. So I'm so excited to bring on today as my guest, Dr. Masako Chen. Masako Chen is a board-certified cornea surgeon at New York Eye and Ear Infirmary of Mount Sinai. She's currently the director of the Comprehensive Eye Clinic and also Associate Residency Program Director. Dr. Chen treats patients with many corneal conditions, including the many forms of dry eye, and she also performs cataract surgery, LASIK, PRK, and corneal transplants, amongst other eye surgeries. So we are so privileged to have Dr. Chen with us today. Thank you so much for coming on the IQ podcast.
Thank you so much for having me, Dr. Banik.
Absolutely. So I always like to start off my episodes asking my guests to share their journey. So I'm going to ask you, how did you first get into ophthalmology? And then specifically, how did you become interested in the field in the subspecialty of cornea?
Absolutely. So when I was a medical student, I knew that I wanted to do something surgical, something with my hands. And I found that ophthalmology allowed the continuity with the patients. You get to see patients of all ages, but also use your hands in a precise manner to bring about and improve the quality of their life. And I really think that, one, the surgeries were beautiful. I saw somebody fix the pupil with a single thread, single stitch. And I saw a lot of great outcomes with cataract surgery, and the patients themselves said, wow, my life is entirely different now because I'm out of glasses, or, I can see, the colors are so bright, vibrant. And I think that really cinched it for me with ophthalmology. In terms of cornea, again, I thought that the surgeries, again, were beautiful. We can make really significant improvements in patients' quality of life, whether it's cataract surgery or corneal transplant surgery, or just improvement in their dry eye, which plagues a lot of people and is really disturbing to their daily life.
Thank you for sharing that. As many of us in ophthalmology, we fell in love after having witnessed some procedures that can really transform a patient's life. Now, I wanted to really focus on dry eye, which is a condition that can really negatively impact someone's quality of life. And as I was saying earlier, almost anyone can get dry eye. So it's not just a disease that happens to people as they get older, in midlife, or in their later years. It can happen to younger adults, even children, teenagers have dry eye. So can you explain to us, first of all, what exactly is dry eye? Like, what is going on when somebody gets this diagnosis?
Yeah. Absolutely. So, as you described, the symptoms of dry eye can vary as well. So it could be burning, redness. It can also be just blurry vision without any pain. And you blink and then it's clear. And then one moment again, it's not clear. And I think the best way to think about it is that dry eye is just a huge umbrella term for multiple different diseases going on, because dry eye comes from having deficiencies in the three main layers of the tear film. And that those three layers are the top oil or lipid layer, the mucus layer, and the aqueous layer. And there can be deficiencies in either one or multiple or all of those layers. And that's really where the dry eye and different types of therapies come in, because you have to tailor your treatments to which type of dry eye the patient has.
Hmm. So I know that there are different categories of dry eye. Can you just summarize, like, what are those different categories, and how can a patient tell the difference, or is it something that they really need to see a provider for?
I think it's tough for the patients to tell a difference. So it depends. It really is based on our exam and our tests that we do. The different types, the main ones would be evaporative dry eye, which has to do with more the lipid layer, typically that top layer. So let's say you are looking at the computer and your oil glands are a little bit clogged, so the top layer is missing or not high quality. Then you may notice that over a long term use of the computer at the screen, it gets really blurry or gets really tired. Another type would be inflammatory dry eye that may be related to either um, use of some topical eye drops that the patients have to use for glaucoma, or just inflammatory from eyelids. So there's inflammation you can get from just normal bacteria that's on the skin that just overgrows, or mites even that grow. And there's different drops for that. And then there's also just aqueous deficient. So you don't produce enough of that liquid tears. And that can be from a multitude of factors, including autoimmune, has to do with gender and age as well. And so those are the three main categories.
Wow, that's so interesting. I've always read about or heard about the two types. I wasn't aware of this separate inflammatory category. I always kind of think of it as meibomian gland dysfunction, which is when the glands in the eyelids are not producing healthy oils. And then there's aqueous deficiency. But that middle category you mentioned, is that
Mhm.
something that people are now like really focusing on, or is that a way that you've found has been helpful to explain to patients?
I think that's a different way to sort of explain to patients, but also there's testing as well, point of care testing in the office that we do. So there's a specific test called MMP9. It's a factor. It's an inflammatory factor that we can find in your tears by just taking a little bit of your tears and putting it in a test strip. And if that's positive, then we can start some anti-inflammatory drops that will increase the production of your tears, but also um, reduce the inflammation. So that those drops are typically like your Restasis or the Sequa categories that we typically start for those patients.
Mm-hmm. And in terms of that category, again, this inflammatory category, you mentioned mites.
Mhm.
So can you talk a little bit more about these mites? Who gets them? Why do they get them? What can you do about them?
Yes. So it sounds very gross. And every time I say mites to patients, they get a little bit, uh, you
Little
know,
queasy.
a little queasy
Yeah.
about it, but it is extremely common. It doesn't really have to do with your poor hygiene or anything like that. It's a very common skin mite. It's called Demodex, and it lives around the base of your lashes. And everybody washes their face, but I think a lot of times the eyelashes and the lids are forgotten. And if there's too many of them, it can cause dry eye or make dry eye worse. So there are multiple treatments for that. First would be cleansing the lids with a tea tree oil based cleanser that's made for the eyes. There are multiple ones out there on the market over the counter. There's also a prescription eye drop called Xdemvy, and that is a 4-week course of an eye drop, and that will get rid of the mites very efficiently. And that usually does help the patients with dry eye related to the mites.
Hmm. I remember reading somewhere that the prevalence of mites increases with age, and by the time somebody is, maybe in their 80s or 90s, almost like 100% of people have these eyelid mites. Is that true?
I would say it's very, very common. So it's a common finding that we see in our eye exam is what's called collarettes, and that is likely the mites hugging the lashes. I've also seen if you just take a piece of Scotch tape and put it on your face and look under the microscope, that you can find those Demodex mites too. So I think it's extremely
Yeah, so
common.
people, just to, if you're not an eye care provider and you're listening, so if you look at the base of your lashes and you see kind of like this dandruffy material that's like hugging or around the lash, then that could be an indicator of having mites. But I don't want to scare anyone. So definitely get it checked out. Go see your eye
Mhm.
doctor. And again, it's very common.
Very.
And sometimes even after treatment, sometimes it comes back, right?
Yes. Yeah. So that's the maintenance is important as well, which is part of it, is that the patient has to maintain their eye health by cleaning the eyelids every night before bed. Sometimes putting tea tree oil on a wool ball and putting in the laundry will help get rid of some of the mites that can live in the pillows and pillowcases.
Mm-hmm.
And all that can be very helpful too, but it is something you have to maintain.
Yeah. And as a related question for those who are listening who wear eye makeup, particularly mascara, is that something that increases or decreases the risk of mites? How does that kind of play into this all?
Definitely, it will increase the risk of the mites as well, because as much as the mascara, we try to keep as clean as possible in that tube, it will harbor bacteria, but also mites as well. And I just ask the patients to replace them every month or so.
Oh, every
Because
month. I used to tell
yeah, it's
patients
a
every
lot.
2 months. So you're every
Yeah.
month. Okay, wow. That can be
Um,
expensive, right?
yes. Well, I like the trial sizes. And
Oh,
maybe
the
that's something.
smaller ones. Yeah. And I know a lot of people also, there was this fad. I think it's kind of fallen out of favor now, but or maybe some people still do it just to get those eyelash extensions with glue
Mhm.
and I know that that can also irritate the lashes, but does that contribute to mites or does it make things worse when it comes to dry eye? What's been your experience with that?
I think typically with the mites, it may not worsen them exactly. I'm not sure if there's an exact study that says it will worsen the mites, but I think it will make the dry eye worse, because it depends on how it's done. But the glue, first of all, can get into the eye if you're not careful, and then you have the permanent ones. You're on them for many months, and so I think hygiene wise, it can cause an issue with these
Mm-hmm,
lashes.
mm-hmm. Okay. So now I want to kind of get back to the overview, like taking a step back, looking at dry eye. In your experience, like who tends to get dry eye? Like what in your patient population, for example, and I know what happens in my patient populations. I can share
Mhm,
that as well. But
mhm.
as a cornea specialist, who do you see with dry eye? Like what's the biggest demographic?
I would say women, postmenopausal women, but also we're seeing a lot of younger people who have developed maybe evaporative dry eye because of computer use and screen use. So I see that a lot. There's also a large group of glaucoma patients who have developed dry eye as well, just because of the preservatives that are in the glaucoma drops, which those patients undoubtedly need and should not stop. But a lot of those preservatives can really change the ocular surface and the quality of your tears. And so that is also a large group of my patients as well.
Yeah, I've definitely seen that where patients are on like sometimes 3 or 4 different glaucoma medications and their eyes are terribly dry, like diffuse dryness.
Mhm.
So in those patients, what do you do? Do you typically recommend that they try to switch their drops or just use a different type of lubricating drop for their dry eye? What's the best treatment strategy for that?
Yes, I would say it depends on the type of dry eye that I see in terms of their exam, but I would say that patients who are on 3 drops typically have that look to them where the eyes are a little bit red and inflamed and their lids are very thick and a little bit rosy as well. So the first thing I try to do is to work with their glaucoma specialist and see if there's any preservative-free versions of the drops that they can be on to
Hmm.
control their pressure. And thankfully, there's a lot of newer ones on the market that are preservative free. I think we're moving towards that, which is wonderful. Um, And then eventually, if the patient has a cataract and needs cataract surgery, I think this is perhaps maybe where the role of something called MIGS, MIGS, so minimally invasive glaucoma surgery, which is paired with cataract surgery, can try to get the patients off of some of those
Mm-hmm.
drops. Another drop that I've seen pretty good success with glaucoma patients is called MIBO or Miebo. It mimics the top layer of your tears, and patients find it very soothing, and it helps with sometimes the intermittent blurry vision that you can have from dry eye. And at this point, also, if they're on 3 drops already, it's tough to convince them to start a 4th drop. And
Mm-hmm.
so, Tervaya, which is a nose spray for dry eye, um, has had great success as well. It's twice a day in each nostril.
I haven't tried it myself, but I do have a close friend who's tried it, and she said, unfortunately, it's just like a little um, irritating to the nose. Has
Yes.
been something your other patients have said as well with Tyrvaya?
Yes. So I've actually asked my patients to actually hold their nostril and use their opposite hand to the opposite nostril and just spray into the sides right here. It doesn't need to go straight into the nose, and the excess will come out and you just dab it with a tissue. But that's enough to stimulate basically the nerve pathway that allows for tear
Mm-hmm.
production. And so that's usually what I counsel my patients on, and that might actually help with the
Yeah, that's a
irritation.
great tip. I wasn't aware of just, holding a little barrier here so it doesn't get directly up into the nasal cavities. And just twice a day is enough to last, the full day.
Yes, yes,
Hmm.
twice a day in each nostril.
Yeah, that's great to know. Well, it seems like there are so many different tools now available to help to manage dry eye. I want to get into a little bit more about that. Well, welcome back to the IQ podcast. We're chatting with Dr. Masako Chen, who's a dry eye specialist and cornea specialist. So, Dr. Chen, I wanted to ask you next. I know that you participate in research and are running some interesting studies at New York Eye and your infirmary on dry eye. So, could you share a little bit more about that, what you're doing?
Yes, absolutely. It's very exciting. So we have this imaging device called the Tear Film Imager, and it's collaboration with some of our retina specialists and Dr. Alon Harris as well within our research department. But it allows us to image the 3 layers of the tear film that we talked about. So the lipid layer, the a mucus layer, and the aqueous layer. And it is a non-invasive test. It's you place your head in the machine, and it takes a quick picture with a light, and allows us to measure the quality, the thickness of each of those layers. And my hope is that by imaging all of our patients with dry eye and also normal controls as well, that we get to even fine tune the category of dry eye and fine tune also our treatment. So let's say I see that this patient with glaucoma is on 1 glaucoma drop, has a different lipid layer than the normal control, then perhaps I would start maybe MIBO or really be aggressive about treating their meibomian glands, which produce that top layer. And so that is really the hope with this imaging technique. And just from doing the research and enrolling patients in it, I think that they really think is so cool because it's a non-invasive test that really gets to the root of the problem, and it's a very exciting tool.
Wow, that sounds so interesting. And I can't wait to try it out myself, have my eyes checked because I definitely have dry eye that comes and goes. One thing I wanted to ask you about was with this tool, is it commercially available or is it only available in a research setting?
Right now, I believe it is only available in the research setting. There are 2 that I know of in the United States. One's at Bascom Palmer, led by Dr. Anat Galor, who's one of my mentors, and then one here at New York Eye and Ear Infirmary.
Mm-hmm. And so the only way to get the testing done is to be at a research center, correct? Okay.
Yes, correct.
And is this a technology that may eventually, if it gets FDA approved, that may eventually be part of routine dry eye care? I mean, what do you anticipate with that?
Yes, I think that would be great if it's part of routine care. Again, it's a non-invasive test, so it doesn't have to be the physician operating the machine, which helps, and it can really tailor the dry eye treatment for these patients.
So, one question I wanted to ask you is based off of my personal experience. I'm a contact lens wearer, and I know that my contact lenses can definitely contribute to dry eyes sometimes. So, do you have any tips or strategies specific to contact lens wearers?
Absolutely. I would say if you have dry eye with contact lens wear, first I would make sure there is no contact lens intolerance. So some people can develop sort of an allergy to the contact lenses, and that's a very specific finding on an eye exam. So I would make sure to see your ophthalmologist first. And then second, there are eye drops that you can use with the contact lenses in. A lot of the over-the-counter artificial tears do not allow you to put them in with contact lenses in because they have some suspensions and will blur your contact lenses. But there are drops out there, for example, Ivisia, that will allow you to put the drops in with the contact lenses in. I also find that switching to daily contact lenses rather than ones that you switch out every month or every 2 weeks helps with the dry eye symptoms. And also taking regular breaks from contact lenses as well. So if you don't have to wear them when you get home, take them out and take a break, put some eye drops in. There are also contact lenses that are made specifically for patients with dry eye as well. That tends to be more expensive, and they are usually hard contact lenses. For example, they're called scleral lenses or prose lenses. So for my patients with very, very severe dry eye, sometimes I actually recommend those contact lenses instead, but they're very expensive, which is a huge barrier.
Yeah. Yeah. Some of those strategies you mentioned earlier, I've definitely done, and it's made a big difference. Like I used to wear 2 week lenses. Then when I switched to dailies, things were much, much better. I realized I had much less protein deposits on my lenses. And I think the protein deposits were probably contributing to irritation and dryness. And then, just using rear wetting drops that are made for contact lenses that can make a big difference. And doing a short contact lens holiday. I mean, sometimes for our patients, we ask them to stay out of their lenses for a week or two just to let the surface of the eye nicely heal. And then they can go back to wearing their lenses, maybe perhaps not continuously, but with shorter periods of time that can make a big difference. So Dr. Chen, I wanted to ask you in our last few minutes together, in my the people who are listening, a lot of them are very interested in home remedies, things that they can do lifestyle wise or nutrition wise when it comes to dry eye. So what are some of your recommendations, or what's been some of the research that's been done using home therapies or nutrition and lifestyle strategies for dry eye?
So I would say that there's been a lot of research on omega-3s or omegas in general. And I know that there are multiple ones mentioned in your book that can help with dry eye as well, mainly related to the quality of your meibomian glands, which is the oil layer that we're talking about. They produce the oil layer. And so I would say that that's an exciting thing. And having, a diet high in the omegas or the healthier omegas can definitely help with dry eye. I also think hydration level is very important as well. So making sure that you drink enough water throughout the day, which is very tough to do actually if you're always on the go. But that also has helped a lot of my patients. And then also environmentally, keeping humidity levels at a certain level, usually around 30s or 40s, can help as well. A lot of my patients just anecdotally say, well, I went down to Florida where it's a little bit more humid. And I noticed an improvement in my dry eye. Not to say that patients in Florida don't have dry eye, but that is certainly an important factor as well.
Yeah, related to your the environment, I oftentimes ask patients, what is your workstation like? Are you sitting by the fan or by the vent? And is there forced air being blown towards you, whether it be air conditioning in the summer or dry heat in the winter? It's really important to think about like where you're sitting in the room and where the source of air is coming from. Because simply by making a small change like that, moving away from a vented area can make a big difference in dry eye. Sometimes I've even had patients who, they wake up with very, very dry eyes and they happen to have an overhead fan over their bed. And the fan is running all night, and that's definitely contributing to their dry eye. So think about all the things in your daily life and how you have your home set up and how maybe you can optimize it a little bit. Another thing I love is you mentioned hydration. Definitely, drink plenty of fluids, but also in terms of the humidity, sometimes I recommend like the patients have a little desktop humidifier, like a small desktop unit right by their computer. And so there's this mist like right around their workstation. So they're at least getting that from their environment. So little things can make a big, big difference here when it comes to dry eye.
Yes, absolutely. And even when we had, the forest fires and there was more air pollution too, we noticed that there are a lot more patients coming in with just flare ups of their dry eye. And I think certainly that can contribute as well.
Yeah. Dr. Chen, you mentioned earlier about the omegas. Do you have a particular amount that you recommend people get on a regular basis? Either, if they're getting it from their diet, like how much should they be getting, or if they're taking a supplement? Do you have any specific recommendations about that?
I don't actually, and I think that it's just such a very high amount that is used in some of the research that's been done, and it's difficult to get it from the diet. So I think usually supplementation, but I don't know if we've exactly honed in on the exact dose that will make a measurable difference in dry eye. But I think
Yeah,
you might actually know more about that than I do.
According to the Women's Health Study, which was done in female nurses, I think back in the late 80s, early 90s, they followed these patients out for years, decades actually, and they found that the cohort that had dry eye versus the cohort that didn't, the ones that didn't have severe dry eye, they were having fish about 2 or 3 times a week. And the fish, just from their diet, was providing them with their omega-3s. And the fish that were most effective were tuna and salmon, and I believe it was sardines, if I'm not mistaken, but I think those were the three. And then in terms of supplementation, there's been a range that's been used in various studies. The DREAM study, which you probably know a lot more about this than I do, but it compared an omega-3 supplement with a control, which was not really a control because it was actually olive oil, and both groups improved. So that I think they were using about less than 1,000 milligrams of omega-3s in that diet, in that study. I typically recommend much higher actually for people with severe dry eye. And if they're not getting it from their diet, then I recommend at least 2,000 milligrams a day. That's not forever, but at least for 3 months or so to get their stores built up. And then they can go back to their regular supplement or their regular doses.
Mm-hmm.
That's what I found to be most effective. It's about 2,000 milligrams of DHA, EPA, and then you can tack on the other omegas as well for added anti-inflammatory benefits.
Mm-hmm. Yeah, usually I have them on 1,000, but sometimes clinically the difference isn't there for the patients. So.
Yeah, I think that's, the studies have all been done with that range, about like 1,000 or less, but I think it probably needs to be a little bit higher, at least with my patient experience.